Hello everyone, my name is Ibrahim, and I'm the operation manager here with Lynn Welding. I'm here with Dr. Thomas Brown, the Chief Medical Officer with Cases Urgent Care, and we're here to address all the questions that came from our fellow employees at Lynn Welding regarding the COVID-19 vaccination. I guess I want to start with thanking Dr. Brown for coming over here voluntarily to help us address these questions. I also want to thank all the staff members and nurses from Cases Urgent Care for being very supportive with us through the pandemic. We've been having a great thing going here with Cases Urgent Care. They've been coming here on board at least once a week and to COVID test our team members. And it's been great because we were able to identify any cases and protect the other employees from getting exposed to COVID-19.
So Ibrahim, thank you for the invitation. I think what you did is great. You guys went right to your employees and you asked for them to give you questions about their concerns about getting the vaccine or not. And these are the concerns are certainly going to represent the concerns of the United States in general. So all the talk, if you turn on the news at night, well, of course there's politics, but there's a lot of discussion about the vaccine. Is it safe? How effective is it? Can you still get sick if you've had the vaccine before? Do you produce antibodies to the vaccine shot? It goes on and on and on. Definitely. So I think it's good that you've generated some questions, and to the best of my ability, I will try to answer them for you.
Thank you. Yeah, we want to make sure that the people get the best information they need so they can make the decision they think best for themselves and their family. So I guess we're ready. You can start.
Yes.
So first question came here is, does this vaccine proven to be protective against the new COVID-19 variants?
All right, so excellent question. So in the last 6 weeks, 7 weeks or so, folks, if you're watching the nightly news, you're going to hear discussion about these variants. So as viruses, coronavirus is a virus. It causes COVID-19 infection. And the COVID virus, or the SARS virus, it does accumulate mutations as it replicates in cells. I don't want to go into the details too much, but some of those mutations confer advantages to the virus so that they can spread more easily, or perhaps they can kill more easily. And so we have variants from South Africa, we have variants from Brazil, we have variants from the UK. The real question, there are a few concerns, is how much more contagious are these variants? How much more lethal, if at all, are they? And then the real question that was just asked me is, are the vaccines effective against these variants? Now, the preliminary evidence suggests that the vaccines will be effective against the variants, albeit perhaps with a slightly reduced efficaciousness. So, whereas Moderna and Pfizer produced evidence to suggest that their vaccines were 95% effective, perhaps they're 85 or 80 or 75% effective against the variants. So right now, we're optimistic that the current vaccine should do the trick with the variants, but this is an ongoing thing, and it's being studied daily. And if additional vaccines have to be produced against these variants, then that's the next step that the pharmaceutical companies and the government will take.
Great, thank you. Next question came is, who can take this vaccine?
So who can take this vaccine? Really, there's very few limitations. I would encourage everyone to take the vaccine. Now, certainly the vast majority, over 80% of the people who pass away from COVID-19 infection are above the age of 65. So above the age of 65, especially if you have diabetes or heart disease or obesity, I would strongly encourage you to get the vaccine. So this is really an age-based thing. There's, we want healthcare providers and employees to get vaccinated. We want first line or essential workers to get vaccinated. But I think it's critically important to vaccinate the elderly people first, because they're the ones who actually die And it looks like the government has switched recently in the last week or two to that algorithm where we're vaccinating. To answer the question just a bit more, if you are a healthy person, you should get the vaccine. If you're an unhealthy person with diabetes and heart disease, that's even more reason to get the vaccine. There's only a few groups of people that we haven't studied with the vaccines, and the initial study trials didn't include pregnant women or breastfeeding women. So we can't say with a high degree of certainty how safe it is. The preliminary evidence suggests that it's extremely safe for pregnant and breastfeeding women to get the vaccines, but we don't have enough data at this point in time.
The next question came in with little to no long-term testing. How do we know the vaccine is safe?
All right, well, that has a lot of people concerned, really the long-term side effects. We now have 30 million or so shots in American arms, so we know short-term this is extraordinarily safe medication. They'll watch you for 15 minutes or so afterwards just to make sure that you don't have an allergic reaction. Not a single American, thank God, knock on wood, has passed away from getting vaccinated, either the first or the second time. So really, everyone should get it, and it looks to be extraordinarily safe in the short run. Now, I can't lie. I can't tell you for certainty that 5 years from now, there could be a long-term complication of the vaccine. It's highly unlikely. If you look back at all the other vaccines we've done over the decades in the United States, there's very, very few long-term side effects. So we should assume the same here, but I just can't say with certainty, of course, because it's only been about a year.
So even if there is a longer term in 5 years from now, it shouldn't be something very complicated, like in terms of medical, like nobody's gonna get like a heart attack from after 5 years from now because of the vaccine or something like this.
Right, there's no evidence at all to suggest that someone is going to be more likely to get diabetes or to have a heart attack or to have a medical condition, a rheumatoid arthritis. Every indication is that it's going to be extremely safe in the long run. And it's been extremely safe going on a year already. But I can't, of course, answer for certainty what's going to happen in 5 or 10 years. But all the evidence suggests that it shouldn't be a concern at this point.
That's great. I have another question came in. Should people with certain medical condition or taking medication not get vaccinated?
Frankly, and I think I said this before, really whoever can get access to the vaccine should get the vaccine. If you're healthy and young and you can get the vaccine, you should get it. If you're over 65, whether you're healthy or you have a lot of comorbid conditions, it's even more important for you to get it. So really, everyone should get the vaccine if they have access to it. Again, there are certain groups like pregnant women and breastfeeding women who we don't have strong data yet. I'm sure we will in the next month or two. But aside from pregnant women and breastfeeding women, I think whether you're healthy, whether you're sick, whether you have what's called autoimmune conditions where your immune system is weakened, rheumatoid arthritis, psoriatic arthritis, multiple sclerosis, those type of things, or whether you're taking a medication that suppresses your immune system like Humira or methotrexate or prednisone. You know, there is debate in the medical community, but at this juncture, it appears that really, regardless of what medical conditions you have and medications you're taking, you should get vaccinated if you can get the vaccine.
Great. Next question, what is the ingredients of this vaccine? I know it's a longer question to answer, but you can get a general answer at least.
So I'm certainly not expert enough in the field to know the precise ingredients of the vaccine. I do know a few things. A lot of vaccines historically have egg-based products as part of the vaccine, and this vaccine does not. So that bodes well. So people with egg allergies and dairy allergies and things like that, they've been able to take this vaccine without difficulty. It is a different, I'm not going to get into the weeds here either, but it's a novel type of vaccine. It's called the messenger RNA, mRNA-based vaccine. It's actually the genetic material of the virus that we're injecting into the body rather than a protein of the virus that we do inject into the body for other viruses. And that's part of the reason that we've been able to develop this in 8, 10, 12 months instead of 8, 10, or 12 years. So in general, it's safe for folks, but of course, if you have a history of severe allergic reactions or what's called anaphylactic reactions, then you really want to, I would still recommend it, but you'd want to talk to your doctor. You want to be followed for 15 or 20 minutes after the shot. You'd want to have an EpiPen nearby, God forbid, just in case. So that's that.
That's great. Another question is it as safe as the flu shot?
So the preliminary data suggests it's absolutely as safe, if not more safe than the flu shot. Again, there's a lot of misinformation out there, which is quite unfortunate. And you turn on one news station and you get this information, you turn on another news station, you get something slightly different. So it's unfortunate there's a lot of misinformation out there. But again, right now, after 30 million shots or so in American arms, knock on wood, not a single person has died. It appears to be, all vaccines appear to be extraordinarily safe.
Okay, another question, a little funny, but the guy, one of the question came in, does the vaccine has a tracking chip? So I don't know. So it's a humorous, but it's sort of a serious question as well. I mean, let's obviously I'm not going to get into politics, but I will say everyone knows how polarized things have become in this country, and some people simply don't even believe that this virus exists, and so there's lots of conspiracy theories going around, but no, there's no, Bill Gates is not behind this. There's no chip that's going to be implanted into your arm so that Big Brother government can follow you around. I think as time goes on and more tens of millions of Americans get vaccinated, the folks who are on the sidelines, they're going to get more and more comfortable, more comfortable with getting vaccinated themselves. And I think these concerns, I don't want to say conspiracy theories, but these concerns I think are going to go away over the next few months. That's great. I guess this question is actually more of came from me, myself, and I just want to make sure that our team members are more comfortable with the vaccine. I know Dr. Brown, you got the vaccine yourself, first and second shot, right? And would you recommend this vaccine if it's available to your family, like your kids or your wife, your parents?
Absolutely, without hesitation. If I could vaccinate my wife and my 2 teenage daughters today, I'd get them vaccinated. I received my first shot, and then 26, 28 days later, I got the second Moderna shot. I had nothing but a slightly sore arm for a day or so, no side effects. Again, the preliminary data is that it's extraordinarily effective. So the more Americans we can get this into, the quicker, the better. And part of the reason I'm happy to answer these questions for you here is hopefully this helps give your employees some sense of comfort that this vaccine is safe, and that by taking it, not only can they protect themselves from getting sick, but perhaps more importantly, they can protect their elderly grandparents and parents potentially passing away from the infection.
Yeah, like I have a lot of folks work here, and they take care of their grandparents, and they have older parents with like diabetics and things like this, and they keep coming and asking if they worry, because we're an essential worker, so Lynn Welding is a defense contractor, so we have to stay open and we have to keep the business running, and some of these guys get concerned that they gonna get COVID or something from being here. So I try to encourage them to maintain the social distance, they try to follow all the safety guidelines, but also I try to encourage them to take the vaccine, because the vaccine is is gonna be like helpful for the long term?
So the vaccine has always been the light at the end of the tunnel. We have therapies, dexamethasone, monoclonal antibodies, a few other things coming online. Social distancing and wearing masks is going to continue to play a large part in the next 6 months or so. But yeah, the cure, so to speak, is the vaccine. And to the extent that you can continue encouraging your employees to get the vaccine, that's what needs to happen. And really what happens, just so you're aware, is, let's say, I don't know the precise population of the United States, but let's pretend it's 350 million Americans. You want to reach a herd immunity, which means 70, 80, 85% of the people have been vaccinated. At that point, the virus can no longer have enough uninfected or unvaccinated people to survive, and the virus goes away. So you don't see measles, mumps, or polio anytime these days, right? And that's because people got vaccinated and they reached herd immunity, and the virus simply didn't have enough hosts, so to speak, to survive. So we got to get up there. I'm not sure what percentage. I think we're around 10 or 15%, 10% or so of the population right now has been vaccinated. But once we get up to that herd immunity of 70 or 80%, which I would assume is going to occur by early summer, we're going to be very close to being through with this damn thing. So,
yeah, and as we're getting vaccinated, do you think it's still important to maintain the social distance and still wear masks, even when with the staff members here, if they still get the vaccine, they still have to wear masks, you think?
Yes, because there's too many unknowns. So here's where I'm kind of wear two hats, a physician hat or a public health official hat. So as a physician, for example, I've received both vaccines. In theory, I've produced immunity antibodies. I should not have to wear this mask right now. In theory, I can't get the infection, nor can I give it to you. In theory.
Of course.
But we don't have that data. So it's possible that I could get infected, not even know it, because I've been vaccinated so I don't get sick, and pass that virus on to you. It's possible. We don't think so. I mean, at a very small rate, 1 or 2 or 3% perhaps, but it's highly unlikely. But because we don't know for certainty, even if you've been vaccinated or even if you've had the COVID infection, for the next 4, 5, 6 months, we're going to be stuck with wearing masks and doing social distancing.
It's great. So from a scale 1 to 10, how much would you recommend taking the vaccine? Sorry, last question.
Well, see, so I'm a physician. So I would recommend 10 out of 10. But I have to be sympathetic and compassionate with people who are not in the medical field. There's a lot of political stuff about this. There's a lot of theories going around. So I understand people have concerns. But from the background of a physician who mandates everyone getting flu shots all my employees getting flu shots every winter, who's seen what, the polio virus and the measles, mumps, rubella viruses, what you see when you look back through history, smallpox, and you see that all these diseases have essentially been eradicated because the people took the vaccines, it gives you confidence that that's exactly what we should do in this situation as well. You got to remember, one more time, this is the worst pandemic since 1918, so in 102 years. This is far and away the worst pandemic. So taking the vaccination, 10 out of 10 is what I give it.
Great, thank you. I guess this is all the questions came across from our team members. I hope we addressed all the concerns and questions you guys have here at Lynn Welding, and we'll make sure to share this online to all the folks in the industry. Dr. Brown, thank you very much for making time. I know you're so busy, and thanks for making time again. Thanks for all the staff members of Cases Urgent Care.
Thank you for having me. I appreciate it. You have a great day.
You too.
Thank you.